Hi, I'm Elaine Khoong. I'm an affiliated faculty at the Philip R. Lee Institute for Health Policy Studies. I'm also an assistant professor of medicine at UCSF in the Division of General Internal Medicine, as well as the Center for Vulnerable Populations. So lately, I've been doing a lot of thinking about the accessibility of digital health tools. So things like telemedicine, remote patient monitoring, mobile health apps. And specifically the usability of these tools in really historically excluded populations. So populations with limited English proficiency, those from Black, Indigenous, and people of color, as well as low-income communities. And really, in this regard, I think a lot about a couple of things. I'm a primary care clinician at San Francisco General Hospital, which is our safety net population that really serves a low-income, diverse population. Really, over half of my patient population has a non-English language preference, and then overwhelmingly, really a geriatric population. And so, a lot of with COVID recently, there's really been a huge move to digital health tools. So specifically telemedicine, of course, but also really thinking about things like patient portal, as well as remote patient monitoring for a lot of patients and a lot of chronic diseases. We can obviously manage those at home if folks have access to digital health tools, have access to blood pressure monitors. And so I've really been thinking about how do we make these tools accessible for historically excluded populations and in safety net settings. And part of the reason that this is really important to me, or I've been thinking a lot about this, is for really older populations and folks who've had a hard time accessing traditional in-person care, digital health tools really have the potential to improve healthcare access. Several of my patients, really have to take, for example, 2 public buses to come to our clinic. And so for some patients, that's really an hour and a half commute to come see me. I'm often running late, 20, 30 minutes late. They'll see me for maybe 20 minutes and have to make it back home. And so really traditional healthcare has really been quite inaccessible for lots of patients. And on top of it, really, our traditional mode of delivering health is really focused on giving patients care during discrete clinical visits, right? So we see them every 3 months, we change medications, we manage their chronic diseases. But the reality is with mobile health tools, with digital health tools, we can really continue providing care between discrete clinical visits and really extend our care spectrum. And so this is something that's really important to thinking about making healthcare more accessible, more equitable, especially for folks who have really significant barriers to accessing accessing in-person care. And this is just super important right now for a couple of reasons. I think one, right now, COVID has really made clear that digital inclusion, access to digital technology is crucial is crucial as a social need for health. So it's really a social determinant of health. I think people have noted that it might even be called a super social determinant of health if you think about applying for unemployment insurance or applying for food benefits, for example. Some of that actually requires you to be able to access online applications. And so right now in this moment, digital health is extremely important and digital access is important. In addition, I think in the last 2 to 3 years, really and the healthcare system broadly has really started to face the deep inequities and disparities in our delivery of healthcare. And digital health a lot of people have been really worried about whether or not it's going to exacerbate disparities. But I think digital health in and of itself is really just a tool. It can either worsen it or it could improve disparities, and we really need to be thoughtful about how we implement it. And right now is the perfect time for thinking about this because COVID has really changed how we deliver healthcare, especially with telehealth. There have been so many changes to telehealth policies and telehealth flexibilities. And as payers and policymakers are starting to think about really what are the long-term policy changes we want to make, which telehealth policies we really want to extend to become permanent, it's really important that we are thoughtful about implementing policies that are going to be equitable for low-income populations. To really to mitigate really some of the structural inequities that have impacted these historically excluded populations in the past.